Welcome to Indiana Newsdesk. I'm Joe Wren. Well, the World Health Organization declared coronavirus a global health emergency this week, signaling the risk of the virus spreading outside of China. Nearly 8,000 cases have been reported, with around 170 deaths so far. And the first person-to-person transmission of the virus in the United States was confirmed this week in Chicago. With us now is Mitch Legan, who's been reporting on the virus, to update us on the latest. Mitch, thanks for being here. First thing, there was a report of a possible case up in northwest Indiana, Porter County. Any news on that one?
So yes, actually right before we got on here today, I received word that it actually might be the flu and not the coronavirus, but I haven't been able to confirm that, so I'm not reporting that now. But it's still something we want to keep an eye on because obviously Porter County is close to Chicago, and as you said, that's where one of those confirmed cases of the coronavirus is. I spoke with Porter County's health administrator earlier this week, I believe on Wednesday, and she said one of the really tough parts about the coronavirus is that the symptoms are really close to the flu, so it's tough to tell whether you have coronavirus or influenza.
You also sat down with Bento, a professor of epidemiology at IU. What did she say about the potential spread of this virus? Yeah,
and so she's been working on this since January, and what she really tries to dive into is, how these things spread and happen and really become kind of outbreaks. And what she said on Thursday was that her research was showing that there was possibility for that human-to-human transmission, and of course that was confirmed yesterday in Chicago.
This virus is novel in the sense that it's the first time that it has been reported as being potentially infectious from human to human, and not this occasional spillover event of a jump from one type of animal to humans, who are of course also animals.
Right, and so, obviously this is something we want to keep an eye on because it's up in Chicago and it's something that is, rapidly evolving. But she says we don't want to be too alarmist about it because, there are 6 confirmed cases in the U.S. where there have been thousands of people dying from the flu all year.
But we also know that SARS, which was an outbreak that was of significance in 2003, had that kind of average about a 2.63, so very close to what we have now, and was only able to infect 8 million people. And I don't mean to minimize, of course, 8 million people is a lot, but to put it in context.
And of course, there are a lot of international people here, and especially at universities like IU Bloomington. What are university officials saying? Right now?
So actually today they came out, there's going to be a travel ban for all students, faculty, and staff, so nobody from IU is going to be making a trip to China anytime soon. And we spoke with Chuck Carney, he's IU's spokesperson, earlier this week, and here's what he had to say.
Our environmental health and safety office is very much keeping an eye on this on an hour-to-hour basis to make sure that we're keeping up with what we need to as this progresses.
And, Joe, he emphasized that there are no suspected cases of the coronavirus at IU. He really wanted to hammer that home.
All right, Mitch, thank you very much.
Thank you, Joe.